method. Today we're going to be talking about trunk mobilization that is appropriate for anyone postpartum, whether it was a vaginal delivery or a cesarean. One of the biggest pieces that we see with our clients is restriction through the core canister. What that means is that we're not able to get into our full expression of our diaphragmatic breath, which helps to contribute to a really healthy baseline for our pelvic floor. So one of the things that we'll incorporate throughout this tissue mobilization video is utilizing our diaphragm and utilizing our diaphragmatic breath to help to get out of restriction and into more functional mobility. For today's class, you are going to need your bloom ball, a stretch strap, or a belt, and you may or may not use a yoga block. Otherwise, you can sit in a chair or just simply on your mat. For now, we're gonna start on our backs. So you're gonna meet me on your backs with both knees bent. We're going to start by working on our diaphragmatic breath. So the first thing you're going to do is place a hand on the belly and place a hand on the chest. You're going to take a deep inhale through your nose and think about filling your belly hand. The chest should minimally rise and fall. The intention of this breath is to bring that entire inhale into the belly. Because of the design of our core canister, as we inhale into that diaphragm, our pelvic floor will actually lengthen and relax. And this is something that we don't tend to do very well, especially postpartum. Continue that diaphragmatic breath and feel the pelvic floor lengthen and let go on your inhalation. Starting with your knees bent really helps to decompress any extra tension on the fascia of the abdominal wall. To begin to elongate through that fascia, we're simply going to extend both of our legs down to the mat. Continue with your diaphragmatic breath, inhaling into the belly and exhaling out. 3 more breath cycles here. Think big belly, hard belly. Exhale, relax back down to baseline. One more big belly breath. Feel that pelvic floor lengthen. And exhale. Now we're going to make this move a little more dynamic by placing the palms at our sides. On our inhale, we're going to continue to use that diaphragm breath, and we're going to reach and extend our arms up overhead and then return them back down to our sides on the exhale. What this is going to do is to create a very light tension along the fascia of the abdominal wall. So inhale, belly breath. Arms come overhead. Exhale, let it out. Arms come back down to the side. Let's do 3 more here. And if that movement ends up being too much, and you start to feel yourself arch through your low back or it's uncomfortable, you may just leave your arms overhead and bend both knees to help to decompress the low back fascia to make it a more comfortable move. From here, you're going to meet me onto your belly. So we're going to turn on our mat to be face down. And we're going to start relaxed, forearms down onto the mat, palms facing each other, or you can place them straight down onto the mat. And we're going to do a prone press up. So on our inhale, we're going to think about slightly pressing up, keeping the pelvis connected to our mat below us. And you might feel a light stretch through the fascia, especially if you're post-cesarean section or around that incision site. Breathe into that. Continue your belly breaths. That diaphragmatic inhale will also create a light stretch on that fascia. Exhale, relax. We'll do 3 breath cycles here. Breathing into the belly. Feeling our pelvic floor lengthen and relax on each of those inhales. One more. And exhale. To shift the focus to our obliques, we're going to simply walk our forearms to the corner of our mat. So if we walk to the left, you'll feel that right side of the side body elongating through that fascial plane. Take a couple of diaphragmatic breaths here. Inhale into the belly. Exhale, relax. And if you feel like you need a little more, you're simply going to place the palms into the mat and extend the elbows, pressing up into more trunk extension. That's going to really create a nice stretch around that fascial plane of both the rectus or the six-pack ab, as well as the oblique. We'll do 3 breath cycles here. So inhale, belly breath. Exhale, let it out. We're then going to walk ourselves to the opposite corner of our mat, doing what feels best for your body, either forearms down onto the mat or pressing up if you did that on the opposite side. And we'll do 3 to 5 breath cycles here. So inhale into the belly. Exhale, relax. Inhale, belly breath. Feel that pelvic floor let go and release. Exhale, relax. Last one. Perfect. Next, we're going to grab our ball. So engage your core as you press up. And we are going to work on a fascial release for our obliques. So the way that we're going to do this is to come back down to the mat. Remember to engage through as you're doing your movements and transitions. And the ball we're going to place right in the soft part of the belly. So you're thinking about finding that hip point. You're going to fall just inside that hip point, and you should be just below the rib cage. get that ball seated right into the soft part of the belly. And you're going to use it as a type of biofeedback as well as a little fascial release tool for the abdominal wall. So start by just reintegrating that diaphragmatic breath. So inhale, belly breath. Think about pushing that belly into the ball. Exhale. Let yourself sink in. Inhale into the belly. Exhale. Sink in. If it feels good to you, as you continue these breath cycles, you can create a little movement surrounding your bloom ball. Tiny circles, working a diagonal, coming up and down the muscles. This helps to create a nice little fascial release or abdominal massage as you're breathing into the bloom ball. Let's do 2 more breath cycles on this side. Feeling for those restrictions and where your body is craving that release. Now we're going to switch to the opposite side. So engage through that core, wrap through the abdominals, and you're going to place the ball on the opposite side. Again, finding that soft spot in the abdomen. We don't want to be right over our bony prominences, so we should be on the inside of the pelvis or that hip point and just underneath the rib cage. You can start with doing a little mobility on the ball. Feel where you have most of your restriction. And then start to breathe into that area. Inhale into the belly. Exhale, relax. With the ball, you can take this down as far as just above the pubic bone. For the cesarean mamas out there, you can bring that ball just over the incision, just above the pubic bone, and breathe into that restriction that may or may not be surrounding your incision. None of these techniques should be painful. So if you're experiencing anything other than a very light muscle ache sensation, then you'll want to move off of that area. It might be too soon. Or it might indicate that you need to do some desensitization techniques around that tissue. Let's do 2 more breaths here. Breathe in and breathe out. We're going to engage through our core. We can remove our bloom ball, and then we're going to come into a seated position. Here is where you can use your yoga block. You can sit in a chair, or you can just simply sit on your mat. So assume a comfortable seated position, and you're going to want to grab your stretch strap. I'm going to show you just without, which is another option if you don't have a stretch strap or a belt to utilize. you can simply just do this without any equipment. So what we're thinking about is first getting into a nice, tall, seated posture. You're thinking there's a string at the crown of the head, and you're elongating through the spine, elongating through the trunk. What our body often craves after our pregnancies is elongation through these tissues and release through these tissues that were just put on stretch for the last 9 months. So we're gonna focus on that belly breath. So inhale, belly breath. Exhale, release. If you're using a stretch strap, we're going to bring our arms up overhead, or if you're not, you can just simply bring arms up overhead here. You can interlace your hands if you're not using a stretch strap. And as we inhale, we're going to side bend and think about elongating through that left side by side bending to the right. Feel that stretch through that oblique, through that side body. Take a couple of breaths here, and on those inhales, think about sinking into the position or the stretch even more. On your next exhale, you're going to come back to center. So inhale into the belly. Exhale, back to center. We're going to repeat the same thing to the opposite side. So inhale, elongate to the left. Now feeling that stretch in the right side body. And with each consecutive inhale, thinking about sinking into that posture a little bit more. We're not pushing through pain here, so if anything feels really restricted through the side body, simply come out of the posture and stay where it's comfortable, to where you're still feeling a stretch, still feeling elongation, but you're not feeling discomfort. On that next exhale, we're going to come back to center. Perfect. Bring our stretch strap down. And the last thing we want to prep our body for, and this is a very functional move, it's something that we do so many times per day, it's also where we tend to injure the most, is by coming into and getting our body accommodated to rotation. The tendency is to get out of our deep core engagement prior to rotation, which is why we're more prone to injury there. So what I want you to think about as we go into this rotation is we're going to go there on our exhale. And you're going to think about doing a wrap technique as you go into rotation. So we're going to rotate right first. So let's inhale into the belly. Exhale, wrap. And come into rotation to where it is comfortable to sit here for a 3-breath cycle. One more breath, and on that next exhale, you're going to come back to center. We're going to repeat the same thing to the opposite side. So inhale, belly breath. Feel that pelvic floor lengthen. Exhale, wrap. And come into a comfortable seated twist. 3 breaths here. And on that next exhale, we're going to come back to center. So those are just a few ways that we can start to work through some of the abdominal wall restrictions, specifically in our obliques, that tend to get a little bit cranky after our pregnancies, whether it's a cesarean delivery or a vaginal delivery. This is These are great techniques to start to get more mobility throughout our trunk to help to increase our function. Thanks for joining us today.